Hey guys, my name is Kenrick Hunter, and today I want to be talking about what paramedics actually do. I have been a paramedic since January of 2020, and I have been an advanced EMT since April of 2016. I started at Hall County Fire Services in April of 2016 and went through fire school, went through EMT school. And today I just want to kind of talk about what pre-hospital providers actually do. It's kind of confusing what an EMT is, what a paramedic is. Hope to break it down a little bit for you today. And that I'm going to talk about the education paramedics go through, the duties they need to perform, and where the career field is going. The training to become a pre-hospital provider is kind of different. Um, you have to go through become an EMT or an advanced EMT first. So an EMT means emergency medical technician, and an advanced EMT is emergency medical technician. To become an advanced EMT, which all providers or all EMTs in Georgia are usually advanced EMTs, means they can start IVs and give a few more drugs than normal EMTs. You have about 100 to 200 additional class hours on top of normal EMT school. So pretty much to become an advanced EMT, it's 1 year in college. They have to go through a whole bunch of clinicals, ride the ambulance a whole bunch. Now to become a paramedic, it's another 18 months on top of being an advanced EMT. And the paramedics are kind of like the doctors of the pre-hospital world. The EMTs are almost like the nurses in one respect. I'll kind of get back to that in a little bit too. But to become a paramedic, you have to do about 600 hours of clinicals, including in the ER, CCU, ICU, labor and delivery, OR, cath lab, respiratory therapy, the pediatric units, and multiple ambulance services. Clinicals are super important. You have to deliver multiple babies. You have to intubate more than 10 people, give a whole bunch of meds, be able to run a critical patient on your own before you could be signed off to be a paramedic. So the training is very strenuous. The duties of a paramedic are kind of what I want to talk about next. That's where it kind of gets a little bit confusing. Like I was talking about earlier, EMTs are kind of like the nurses, paramedics are doctors. So most times on an ambulance, there's one advanced EMT, and he is the driver, and then there's a paramedic. But when they get called to 911, there's about maybe two more EMTs, two to three more EMTs that come to the scene. Those are usually on fire trucks. They're all EMTs and they all follow the direction of the paramedics. So the job of a paramedic is to be the first level of care that these patients see most of the time. People call 911 on their worst days of their lives. The first person that comes and talks to them is the paramedic. So his job is kind of to be a detective to see how sick this patient is. Do any immediate steps need to be taken to provide good quality care for this patient? Um, the job of a paramedic is very unpredictable. Sometimes you have like very stable patients in a nursing home that just have abnormal lab work, but then you also have 2 minutes later you have a cardiac arrest in the middle of the woods, and you have to be kind of more of a Swiss Army knife than any other spot in medicine because you really don't know what you're going to get into. And the thing that really changes it that most people don't have in perspective is that to be a paramedic in the field, you're in an unstable environment. So a doctor and a nurse in the emergency room are around multiple trained personnel. They're in a controlled area. Paramedics are in the back of a moving truck going 90 miles down the highway trying to do life-saving interventions. So it's definitely a different kind of job. And I also want to talk about the future of paramedics. The future of paramedics is kind of bright. Paramedics is a very relatively new career field compared to nurses. In 1996, Miami Fire Department kind of started the first paramedic program, and it's just been going up from there. So I live in Georgia. I think around 1975, the first group of paramedics started. So we're kind of only in the second or third generation of paramedics. And right now, there's a lot of changing. It's now more just picking people up, taking them to the hospital. Now it's going to people's houses, doing a full assessment, evaluating them, treating them at their house, and then taking them to the appropriate facility that they need to go to. So all of that training and thought takes more education, more time, more skilled paramedics. Paramedics are also being used in different areas of the hospital, unlike most new careers. The area I work in, they use paramedics as technologists in special procedure rooms. So I work in the cath lab currently, and I work alongside a doctor doing cardiac cath, so interventional cardiology. So me and the doctor are scrubbed in doing this, and I'm doing this under my paramedic license. They also have paramedics in the neuro lab, the EVOR, which is the endovascular lab, the stress lab. There's paramedics that work in the ER. They're kind of going all over the hospital. It's really cool to watch them grow in the hospital, start understanding that paramedics kind of can be used in multiple areas. They're used to kind of thinking outside the box. They can do a lot of skills. Um, it's a really cool little person to plug in somewhere that can be taught. But in the field, there's a lot of new stuff coming too, like community paramedicine, which is kind of when someone gets discharged from the hospital, they will assign community paramedics to their house and basically do checkups on these patients. So they will go over their drugs, do assessments on them, ask them if they have any questions, talk about their prior surgeries or discharge from the hospital. The goal is to make sure the patients don't come back to the hospital. Um, and then there's also critical care paramedics. So the flight paramedics, the ground ambulance that have things like um, stroke units. So they have CT scanners on ambulances with paramedics and doctors and technologists and nurses. They have burn units on, like for in ambulances, where they go around, specialty trained personnel go all around to different areas to pick up burn patients. And it's really like a cool future for the job. And it's cool because we're so new at it that it's just going to keep going and going. Just in the last, since I've been doing it for the last 8 years, I've seen it grow tremendously to where we didn't have a lot of paramedics in the hospital. And now we're the most common use for technologists because we're so diverse in what we can do. Well, I really hope I got to explain what kind of paramedics do, both pre-hospital and in the hospital. I hope we got to talk about the education and kind of how much you have to go through in the steps. The duties of a paramedic are very different than other providers, and the future of the career is extremely bright. We are the Swiss Army knife of the hospital and medical world, and I'm really excited to be a paramedic. Thank you for taking the time to listen to me today. I hope you have a great day.